care about current affairs, it's on the Oshow. And when you want to get clear what's going on here, it's on the Oshow. If you like to stay in the know, tune yourself into the Oshow. It's the Oshow. Laura Babcock's the Oshow.
Welcome to the Oshow, Canada's current affairs show with strong opinions. I want to thank all of you listening across Ontario, across Canada, and around the world in 36 other countries. We have a lot of listeners in the United States especially who are paying attention to what is happening here on the pod. We've got an important conversation today that affects all of us. We're going to be talking about vulnerable seniors and their long-term care with Dr. Vivian. She is famous in this country for her research and for her fierce advocacy for the people who need it the most. So I can't wait to get into a conversation with her and some disturbing new developments under Ford's government in Ontario that are a harbinger for the future, and it ain't good. But also, I want to let you know a couple of other things coming up on the pod. Next time, we're going to have Joe Roberts. He is the Skid Row CEO, famous for being in homelessness in Vancouver, becoming successful in business, and then walking across Canada with a shopping cart to raise awareness. He'll be a part of a special on the Oshow on homelessness. And we'll also have Tara Groves Taylor. She is the CEO of Community Healthcare in Kitchener-Waterloo, one of the fastest growing municipalities in all of our country. And they're on the front line. So we want to find out what they're doing regarding homelessness. Also coming up on the podcast, we're going to be talking to some advocates for people who are living with disabilities. What does it look like as a landscape for them? Do we even know what they deal with? And as we hit this hot summer, the climate emergency, there are so many issues that we need to understand. We'll get to that on the podcast, as well as, of course, politics. Many of you saw our Oshow with Merritt Stiles, the leader of the official opposition in Ontario. That show blew up. We'll have a lot more of those going forward as we deal with elections, both in Ontario on the horizon and federally. Okay, let's get to our guest on today's pod. You've met her before on the Oshow. It's wonderful to have her back. Dr. Vivian, great to see you.
My pleasure. Thanks for having me.
One of my favorite Oshow bits in our closing credits that people will watch with rocker Robin Madger made it for us, but we have you with your arms away.
I never do stuff like that, ever. I'm a little handsy.
Well, yeah. I love it because it goes to your passion, right? You get pissed off, and I appreciate that because somebody needs to. We have seniors who I would put as some of the most vulnerable people in our communities. They are, as you said in a post this morning, often dealing with dementia. They don't have a lot of agency for themselves, and you put out something very provocative. I know it's not provocative in your world, Dr. Vivian, but I think it'll be provocative for our viewers and our listeners. And that is that the Ford government seems to be testing their deregulation and their decertification policies on long-term care residents. So can you just explain that? Like, what have they been doing, and how is that a harbinger for across the healthcare system if we don't fight it now?
Yeah, I mean, a lot of the things that happen in long-term care, they're tested in long-term care almost first because they've got that vulnerable population who often can't speak up for themselves, might not have caregivers nearby, don't necessarily know what's happening. So you see a lot of the things like excessive agency worker use. That's been in long-term care for a long time. Now we're hearing about it in the hospitals, right? So things tend to start in long-term care. The privatization started in long-term care, and you're seeing it now move over to other sectors, mainly acute care, right? So this isn't new. It is definitely getting to a level we've never seen before under the Ford government. But it's part and parcel of a larger pattern of these, conservative governments that are really doing their best to, work alongside the often for-profit lobbies in their provinces to really work to deregulate and to really impact the staffing in these facilities. Because as we know, when you privatize any workforce, the number one way to get profit is by dealing with staffing and cutting back on staffing, hiring lower wage workers, exploiting the employees, union busting, all of these strategies, which we are seeing the Ford government do time and time again, especially with our public sector. I mean, it's not a coincidence, right? When you see these relationships between for-profit lobbies, the government, and then added deregulation are my favorite words because they always have certain catchwords. Modernize, that's a big one, which really just means privatize. We all know this in the literature. So it's really dangerous. And what happened And I started tracking this early in the pandemic. So in November 2020, then Minister Fullerton, lovely Minister Fullerton, who many people refer to as the Minister of Senocide. I always, like that little moniker she earned from the many families that I've talked to over the years. On any side.
You know what? I
So
have
the
to
issue
stop you
is,
there for a second. So genocide is in seniors assault,
yeah,
like genocide, right?
yeah.
I
Yeah,
have never heard
I
that
didn't name
term.
that. Yeah, I didn't name that, but it was trending quite often when she was the minister, because that was the most, the highest fatality period when she was in charge, pre-vaccine, and we were losing, thousands of seniors by the hour. It was a horrific time. That first year and a half was just like nothing I've ever, and I hope to never experience again. And the level of carnage in those facilities. So yeah,
The
many
army
people.
came in. I mean, and this is
Yeah.
not for people who aren't aware.
Yep.
The army actually came in
Yeah.
to help, and were shocked and appalled by what
Oh
they
yeah.
saw. Okay.
Well, what happened was the military, because, one of the things that got me into public advocacy was when they shut down visitors. They didn't allow family. And all of a sudden, overnight, they deemed family non-essential. Non-essential. You're not essential. You can't come visit your loved one. And these families, nobody had a greater impetus to keep these residents safe than their families. Let's be real here. So the idea that was being promulgated by, people in the government and I imagine the for-profit lobby who didn't want them around to whistleblow was that they would bring in the virus. They were locked out for 6 months in Ontario, a year in BC. Look what happened. The virus ripped through all of those long-term care homes. We knew, and we have documented evidence of this from the Long-Term Care Commission, that it was the staff bringing them in. They were the only ones in. So obviously it wasn't family bringing in the virus. So that was complete nonsense. And that's what made me start speaking out, because I knew how important families were to these caregivers, to these residents, and really supporting the abysmal care in these facilities across the board. But then, the Ford government comes in, starts to do things like eliminate proactive unannounced inspections. That started just before the pandemic, which means that, inspectors would just show up at a home. So they didn't have time to prepare, didn't have time to put all of their best staff in place, really staff up the facilities, because we hear this happening, make sure everything's extra clean, all of that good stuff, to catch them as they normally operate. And that was a really good way to proactively get problems documented and to help resolve them before it got to the point of all the homicides we're hearing about, and the neglect leading to preventable death and massive injury and all of these things we know about. So, that was happening. And then the military then came in, and they were in disproportionately for-profit homes. And as this is happening, family are locked out, military are coming in, whistleblowing what's happening. We're starting to get reports from the for-profit lobby that they're asking the government to allow them to hire anyone they want, because there were so many staffing losses, because they weren't giving these workers proper PPE and weren't providing them proper training, infection prevention and control. So they were getting sick, and then when they're sick, they have to go home, obviously, and stay home while they recuperate. So we were having, I remember some days there were like 3,000 staff losses per day in long-term care. Nobody replacing that care. Families still locked out. It was horrifying. That was the second wave, the worst phase in terms of deaths. So around the same time, we started hearing, the lobby efforts coming to the government saying, hey, let us hire whoever, because we just need to get boots on the ground, which really this was, the for-profit's dream all along. They've been chomping at the bit for decades to keep deregulating so that they can just hire subsequently lower wage employees and make more profit off of that staffing model. Keep in mind, what most people don't realize is that 20 years ago, nursing homes were called nursing homes because they were staffed primarily by nurses. Nurses is a regulated, higher wage, highly trained, skilled profession. Goes, they have to have degrees. They have to do, go through credentialism.
That's right.
And then
my mother was actually a lead charge nurse at a seniors home, and she had worked in seniors care, geriatric care, community care for decades before she had that role. So it was a totally different ballgame. And I just want to mention for our viewers and listeners who might be thinking about that awful, awful time in the pandemic, that's when I first met you, Dr. Vivian, online, because my honorary little brother Innes Ingram chained himself to a tree and went hungry. He went on a fast, a hunger strike, until they could get some sort of inspections into his mom long-term, because she was taking pictures of the sores on her arms and what was going on. So he tried to lead that effort. I mean, this was a time where if you had long-term care, you couldn't help but advocate for them, because you could see they were being treated abysmally. I have never heard Sunnyside before, but wow, what a thought.
And something that you also pointed out there that's important to note that Innes was bang on about was that they stopped inspections for the first 2 months of the pandemic, even though people like us were all begging for you to send help into these places, because we knew it was so bad, just even from phone calls with the workers and the residents, right? So we found out, indeed, it was the for-profit lobby who was actively campaigning to stop inspections. Isn't that interesting, right? So they're campaigning to stop inspections. They don't want anyone in there seeing what's happening. And at the same time, they're also campaigning to allow anyone with no credentials or training or infection prevention and control expertise to now work in the most vulnerable, plague-ridden sector. And then you wonder why the outbreaks never stopped. Instead of saying, well, no, hold on, we actually need to bring in people who understand infection prevention and control, because this is literally a matter of life and death with these seniors. We know the rates of death upon a COVID-19 infection before the vaccine was like 20 to 30 times greater for people over the age of 80. So not for nothing, these were the people who were disproportionately dying. And this is why we were seeing that long-term care being it was just carnage. So we knew that there were rumblings. And in November 2020, we get a report. That usually the media will reach out to me when they get a whiff of new regulation or new policy, and they'll ask for my comment. And I was horrified to learn that Minister Fullerton at the time allowed a new labor category in long-term care called resident care aides, RCAs. And I immediately saw it for what it was, in my opinion, just a low-wage exploitation deregulation attempt to really get rid of nurses. Because over that 20 years, when Mike Harris first started getting the for-profits into long-term care in Ontario, this is when we started to see the shift from majority nurses working in these places to then all of a sudden today it's majority PSWs who are unregulated, lower wage occupation, comprised largely of racialized women, many of which are new to Canada and are massively exploited. And there's a revolving door of them. That most of them leave within 5 years. I think there's a 50% retention rate. It's abysmal, and there's good reason. It's a horrible job classification to be in the first place, because they're not supported, they're not protected, they're not regulated. They're not really protected by their own union. I would love if they amalgamated with the nurses union, but that's a separate thing. And that's the issue, right? They're paid significantly less, and now the government said, with the help of the for-profit lobby, well, I guess PSWs earn too much as is. They don't make a living wage, but okay. So we're going to create a new category even below personal support workers, PSWs, that, as far as I see, and this was literally May 23rd. So this is the most recent thing that happened, which arguably, in my opinion, is the most damaging regulation they've ever put in place, where now they can literally hire anyone. You don't have to have any expertise or training, and the devil's in the details. So as soon as I saw the chart they put out and the regulations, I tweeted about them. But I'm going to read specific parts, because it's very important to pay attention to how they're literally in black and white now deregulating the workforce. So now two things it does that are very dangerous, that every long-term care family should be aware of, that is coming. They're allowing long-term care owners, operators, to use their quote unquote reasonable opinion to hire anyone if they think the person has quote unquote adequate skills, what's that, knowledge or training. But there's nowhere that I see in this regulation that has any credentials, actual training or healthcare expertise, nothing. So that is their way to literally now hire anyone and pay them even less than personal support workers. Then on top of it, and this is the kicker, so this is adding insult to injury, they now are letting who they call low risk residents. What oxymoron is that? Every resident in a long-term care home is high risk. The vast majority of them have dementia. They're on 10 or more medications. I mean, this is a very frail, vulnerable, at-risk population. So I don't know how you deem any of them low risk, but okay. They're giving them resident autonomy on whether they want to receive care from this new category with no skills or credentials that I can see. Or a personal support worker or a nurse. So now they're literally handing off the responsibility onto overwhelmingly 90-year-old plus residents. The vast majority of long-term care residents are over the age of 80. Most of them, 9 out of 10, have a dementia diagnosis. So you're going to hand over the decision to these people, whether they, and you think they're going to understand the differences between this new resident support personnel job category you've created and a nurse.
And let's imagine, Dr. Vivian, I know we don't have to imagine, it's dystopic. It's not dystopic, it's happening. You're lying there, you're 90 years old, you've maybe, and we haven't gotten to this yet, been shipped to a long-term care away from your family and community. Isn't that something
Bill
else?
7, yeah.
Right? Yeah. So you don't have your support staff or your support around you, your family.
Yeah, you have no one to know what's going on that day on the floor, who's around.
And you're also probably really trying to get along with who's ever taking care of you, so that they take care of you. So you want your diaper changed, you want your water filled, you want to be seen in the night when you can't.
Just trying to survive.
You're trying to survive. And then they come to you with this saying, you know what, do you want this lower cost option for me to run this business and give you good care, Mabel? Or this, what you've had so far, but is making it a little harder for me to come and have someone check on you in the night, right? Like, how is that ethical?
It's horrific. It's horrific. It's morally repugnant. This government, I've said this about 4,000 times, should be so ashamed of themselves, dripped in shame. I don't know how they sleep at night, but clearly they sleep very well, which is the irony of it all. But this is how it's going to shake down, right?
Maybe they sleep on nice sheets, but do they sleep?
You know what the best part is? If they had to sleep in a long-term care home for one night, forget a week, forget a month, let me tell you how quickly things would change. Now, one of these people has tried staying overnight in these Swiss. I'd love, go, please, try. Do a little study, see what it's like actually living in these facilities, because the people that live there and the families who are there day in and day out will tell you exactly what it's like. And this is what's going to happen, right? So they're going to say, oh, you know what? We hired a bunch of these new resident support personnel. It's probably going to be teenagers. Who the heck knows? They're going to pay them probably 15, 16 minimum wage. We have a bunch of them. They're around. But, you know, there's only one nurse and she starts later, or she's on the first floor. So, like, it might take a while for her to come up. Do you mind just having these people? Of course. What do you think they're going to say? Of course, they're going to say yes. And this is exactly what's going to happen, right? This is deregulation by active design. It's disgusting. And we see where this is going. It's going to lead to more preventable injury, more death. And heaven forbid, if we have another pandemic, you're damn right it's going to lead to more death, because we saw time and time again, when you let people into these facilities, as they started doing as an emergency measure that was supposed to be temporary. And now this is them making it permanent, by the way. They said explicitly, this is just a temporary pandemic measure because we need workers. So then why are you making it permanent 4 years later? Oh, this was your plan all along. And I called it 4 years ago. It's in writing. You can look at the news reports. I very clearly saw this for what it was. And I really wish, you know, more people were talking about this, because this is going to be most seniors care. I mean, very few people are lucky to age at home until they pass. They're just, especially with, ask anyone about home care, it's a mess, and even more privatized mess.
Ask any senior who is visiting other seniors in long-term care how much they fear it. Ask any families, the boomers out there,
terrified
the prices of long-term care. They're terrified about not being able to find a place for mom or dad. So anyone adjacent to the system or has dipped a toe in the system, my mom was dying during the pandemic, knows how atrocious it is, how exploitative it is. And wasn't one of the first things the Ford government did in their first majority was come in and make it so that it's harder for families to sue.
Harder to sue the homes. Yeah. So like you can't make this stuff up. And by the way, I will also reiterate that Bill 218, protecting Ontario, blah, 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 whatever the heck it was called, those nonsense names for these bills. It made it harder for any person, not just in long-term care homes, to sue based on, before you could sue for negligence. Now they said, I had negligence. It's okay that it's going to happen everywhere. Let's now push the benchmark up to gross negligence. It's never been done. It's precedent setting. So now all of these lawsuits waiting to hit the courts, because they're still waiting. We're still waiting to hear about what's happening. And there's thousands of people. It's a class action lawsuit against the 6th largest for-profit long-term care providers in Canada. So that was recently certified to proceed, which is amazing. But that said, we're still waiting to see the results of these lawsuits. But it's going to be precedent setting, because we've never had to litigate for gross negligence. I feel very confident that it's going to be very easy to demonstrate gross negligence based on everything we saw. We have more than enough evidence. But the fact that now they elevated the benchmark to allow even more carnage. And then we said, as this was happening, this is going to create more deaths and more preventable injuries and harms, because now you're letting them off the hook. You're giving them no incentive or modus operandi to actually do better, because you're now making it easier for them to, negligence is fine. You can be negligent. Now you just have to worry about being grossly negligent. In what world is this? What politicians did during the pandemic? But this is what happened. It's horrifying.
A couple of thoughts, Dr. Viv. One is, you've heard that famous expression, never let a good crisis go to waste, right? So the pandemic came in and people set new norms based on emergency response, right? And a lot of people feared what some of those would be. And we've seen some of them continue. But there's also the planning that went into this particular crisis. One of the first matters of legislation to make it hard to sue, right? Who does that unless they're anticipating that there's going to be suing going on? Then this idea of downgrading the certification to work. You mentioned teenagers working there with this new reg. I can tell you, I was sitting in the gym in the sauna once listening to two girls who were doing direct marketing. They were probably like 18, 19, and they wanted to go into PSWs, but it was too high of a certification bar for them.
This is how they're going to get in now. That's how they're going to get in.
And that concerned me listening to it then when they were going to be PSWs. I can't imagine now they can get it as a fast food job, right? It sounds like. So we've got this plan to deregulate this exploitation of the pandemic, now setting this lower tier again. So PSWs seem like a vaulted profession compared to where we are now. So I have to ask you, is this all just a giant profit scheme dating back to the Harris days? Is cruelty the point? Because there's a level of cruelty in these policies, Dr. Vivian. I've worked with for-profit businesses my entire career, as well as not-for-profits. They might want profit, but they have morals. They're not in some morass where they don't care if they're cruel.
Yeah, it's profit-based. And then, of course, cruelty comes by design of that for-profit system. This is why I would never trust for-profit in any, care capacity. This is the hill I will die on. There should be no profit in any care industry. These people that run these facilities, I've said multiple times, go open a Tim Hortons, go open, I don't care, something else. Leave the care of seniors to people who actually prioritize the well-being of these people over profit, because at the end of the day, their fiduciary responsibility is to dole out profits to the shareholders, and that's what they're prioritized to do. Period. So in what bizarre system, thank Harris for this, that gave $1 billion back in the mid-90s to the for-profits to enter into the system, $1 million worth of beds. And then this is now why that kickstarted the for-profit market model of dominance we now have. We have the greatest share of for-profit long-term care in Ontario across Canada. And that was thanks to Mike Harris. So, and it's not a coincidence that after he left politics, he was earning $250,000 sitting on the board of Chartwell, which was one of the biggest for-profit Canadian long-term care providers that is now being part of this class action lawsuit.
Did they get
an advisor board?
Didn't they get $75 million in taxes?
Oh, they get the money all the time. Money all the time. We get records of how they're being rewarded with licenses to keep operating for the next 25, 30 years. So the next generation of seniors is going to suffer the same fate. They instead of taking a moment and saying, like I was begging, and experts who know this sector well, saying, listen, if this wasn't the wake-up call to get rid of for-profit and how important ownership is in this sector and all healthcare sectors, then what is it going to take for you all to see the light? We have glaring evidence. They had the disproportionate vast majority of deaths in their facilities. I mean, I don't even know, 1,000 families across Canada I spoke to. Most of them were from for-profit long-term care homes. It's not a coincidence, right? It's the model they have. They hire less workers. They hire lower wage workers. If it was up to them, there would be no nurses in these facilities. They could hire whoever they want. They're getting there, right? In Alberta, I don't know if you know this, in March 2024, this was a really big deal because, again, this is a concerted effort, in my opinion, by the for-profit long-term care lobby across Canada. And they managed to get Danielle Smith, and we know, what a gem she is. But they managed to allow her, through her helping, to reduce the qualification to need a nurse at all in long-term care. Nurses will be gone under her government starting in, March 2024. This was a few months ago we heard this circulating. The unions representing the nurses were up in arms, obviously so, that you're going to remove nursing care from nursing homes, and they're doing it.
Is this what
it's a ripple effect?
Is this what prompted you a little while ago to tweet out these conservatives are going to kill us? I think those were your words.
That's part of it. I mean, when you see the the massive onslaught of privatization in the healthcare sector. I mean, this is the sector that keeps us alive. If we have demonstrated evidence, it's not my opinion, you know, and I get angry when people are like, you know, the for-profit model isn't bad, you know, blah, blah. I go by where the evidence is, period. This isn't that I know some for-profit people and I think they're jerks. No, I don't know these people. The model, I know the model. I know how they run their businesses. I see the statistics, period. Right? They just have worse outcomes, more preventable injuries, more preventable deaths, more hospitalizations, increased transfers to hospitals, less staffing, they pay their workers less. I mean, all of these things amount to an increased probability that you're going to die prematurely. I'm sorry, but that is the fact. And if you look at the US system, we know that already the differences between US healthcare and how, you know, at the end of the day, they pay so much more towards healthcare and yet they have the worst outcomes. You know, when you look at us and we pay significantly less into our healthcare and we have far superior outcomes. And the main difference is the profit model, right? And there's no question about it. So the fact that everyone knows that the data is there, the data has been there for a very long time. So you have to wonder the cruelty aspect. You know the evidence. You've heard from these families. I see the emails. I get tagged on emails to Ford, Fullerton, all the ministers all the time from random long-term care families who Google my email and just tag me on all these emails. And I see the correspondence being sent to all these politicians, these PC politicians in power, begging them, you know, telling them what's happening in these for-profit homes, begging for a change. They know what's happening. But who's in their ear, right? There's many stories. The HuffPost was really good at this, documenting the number of former Ford staffers who are now, you know, working full-time with the for-profit long-term care lobbyist. So, you know, who are they listening to? Whose ear do they have? It's very clear to me, and I've been very, you know, opinionated on this, that the policies that have come in place, the policies that have, you know, the laws, the regulations have really been what the for-profit lobby has wanted. And this is what we're seeing. We're not seeing them listening to the unions, like the Bill 124, all the things that would have helped, you know, beef up our staffing and help protect the nursing workforce, for example. And not all of that stuff was just ignored. Instead, you found ways to exploit the public sector and the, you know, the public employees to then allow things like agency workers to come in, right? And then oddly enough, charge 2, 3, 4 times the rate and then bankrupt our system. And then that leads you to then justify more privatization. It is literally a web of insanity. It's like this hamster wheel of sheer insanity. And you sit there and you go, how is this happening? None of this makes any sense. None of this is evidence-based. And unfortunately, because they have a majority government, these governments can just do whatever they want. And this is what's happening. And so far, the only people that have been able to hold these politicians to account have been lawyers. Lawyers are the ones that are going to, you know, be able to take them to court. And I wish we had every lawyer going after every one of these cruel, morally repugnant, unconstitutional, and negligent laws and regulations. But we just, you know, we have to wait for people. And often they're funded by, you know, groups like the Ontario Health Coalition and unions who are the ones helping to hire these unions to go after the government. Bill 124 was a result of the unions and people like the Ontario Health Coalition teaming up to hire lawyers to sue them, and they were successful. And they also, the same law firm, by the way, that got Bill 124 struck down is also going after Bill 7. And I will put all of my money down on the fact that will be struck down easier than Bill 124 was to be struck down, because that is the most literally morally repugnant hospital-based law, but which is intimately tied to long-term care, because they're kicking seniors out of the hospitals. And then the condition is, well, if you want to keep that hospital bed, you have to pay $400 a day, or we're going to send you anywhere pretty much across Ontario to the first long-term care home that has an open bed. And guess what? What long-term care homes do you think have free beds? In an area where there's a 40,000 person wait list generally for long-term care, it's the worst of the worst homes. So then you have to think, and if you really go down that nefarious rabbit hole, it's, well, is this another way the government is helping the for-profit long-term care operators, because they only get paid if their beds are full? So if their beds aren't full because people saw what happened during the pandemic and would rather literally walk into traffic than live at those homes, well, then let's create a law that gets them there from the hospital.
And, you know, it takes away their agency when they arrive somewhere where they don't know the people and don't have family and friends nearby. It's ghoulish. It is ghoulish.
Listen, it is, yeah, straight evil.
So let me just end on this with you, because I know how precious your time is, Dr. Vivian. You mentioned some of the remedy is the lawyers, and all lawyers listening. If you care about seniors, you got seniors in your world, and this is what's coming and getting worse. Please get involved. But also for the people who are listening and watching this Oshow, what can they do? Is it supporting the unions in their fights? Is it rallies at the park? What can they do, Dr. Vivian?
Well, you got to vote differently. There's no question about it. You have to pay attention, unfortunately. And, the COVID-19 pandemic created the situation where people were just often so tired of hearing all the bad news that they checked out of paying attention to the news, right? And a lot of people just, when I have these conversations with people randomly, even very, very educated friends of mine, doctors, even I've had conversations with doctors and lawyer friends who are not on social media and as in tuned as the going ons of Ontario politics as some of us are, right? When we're chatting about this informally, and I'll tell them about what's happening, they're like, "What? That's happening? I had no idea that that's happening. That's horrifying." I'm like, "Yeah, yes, I know it is, but most people don't know this is happening, right?" So this is why it's so important to talk to people like you, get this stuff out there to knowledge is power. Know that what is happening, change your vote, because you have to look at what politics and what, parties are voting for policies that will protect workers, because protecting workers protects the patients and the residents. You want well, secure, protected, trained, regulated workers, or else what do you think is going to happen, right? The conditions of work are the conditions of care. And one of my, famous long-term care experts, Dr. Pat Armstrong, who I worked with at York University, was one of the women, she famously said that, right, in her research. The conditions of work are the conditions of care. You cannot neglect the staffing in these facilities and expect that suddenly the residents are going to receive optimal care. What do you, come on. A goes to B, you have to deal with staffing. And instead of beefing up the staffing and making sure that we're having very, rigorous training and credential requirements, they're literally doing the opposite. We are endangering the next generation of seniors. You thought things were bad now. Things are worse than they have ever been before. And when the next pandemic or emergency occurs, you're going to see how that's going to unfold. And I'm dreading it. And I just really warn everyone to prepare for your future now. Start saving money, setting aside, a fund for aging. I really think we need long-term care insurance, but that would be a federal thing Trudeau would need to do. And I've called for that. Other countries do have that. We need that too. So you're not in this position where you're then forced into the worst for-profit long-term care home that has space because you don't have any other options. And that's my fear. And for families, make sure you're jotting everything down, visit those facilities often, pay attention, ask questions. How many agency workers do you have? How many full-time in-house staff do you have? Do you offer training to these workers? What are the credentials of your employees? How do you train them on infection prevention? Ask questions, be the thorn in their side. Nothing's going to change if everyone's silent, right? And doesn't know what's happening. We have to make these people's lives a little difficult, or else they're never going to budge. And when you do make their lives a little bit difficult, you do see things start to move a little bit. And we just need incremental change over time. So the more people that are aware, change your vote, pay attention, ask questions, write everything down, document everything you see, and reach out to people like me with very big mouths who have no problem whistleblowing for you if you need.
Well, I love that. This is the Canada's Current Affairs show with strong opinions, and the strong opinions are needed. They're needed to break through there. Hopefully we don't have to chain ourselves to a tree like Innes did to get heard. We have to raise our voices, though. We have to be loud, and we have to work with each other. And there is an account on X, on Twitter, called Ghost Gurney that tracks all.
I know Ghost Gurney, yeah.
Yeah, they track all the closures of ERs in Ontario, and they have a saying that says either all of us matter or none of us do. And with the silver wave demographic, there's a silver wave demographic.
Silver tsunami's coming.
Yep. Silver tsunami's coming, and this is going to get bigger and bigger, and we've got to get a hold of it now. So name, shame, speak up, advocate, reach out to Dr. Viv. We'll have you back again when you can find the time in the future.
Yeah.
It is so important to just scream from the top of the mountain about this stuff, because those seniors languishing in those hallways and in those terrible conditions, they don't have the agency, they don't have literally the voice sometimes, and we've got to do it for them. Thank you so much for being on the the Oshow, Dr. Vivian. And as
My
I said,
pleasure.
coming up, we're going to have a special on homelessness. They call Mike Harris, some people do, the father of homelessness.
He's a gem.
Might come up in the next conversation as well. But more importantly, we're going to talk about issue identification and solutions. What can we do about these things? Thank you so much for watching the Oshow. Subscribe on YouTube, wherever you get your podcast. Bye, Dr. Viv.
Thank you.
When you care about current affairs, it's on the Oshow. And when you want to get clear what's going on here, it's on the Oshow. If you like to stay in the know, tune yourself into the Oshow. It's the Oshow. Laura Babcock's the Oshow. With a lot of great guests, she puts them to the test on the Oshow. There's no doubt they'll be calling them out on the Oshow. Stand for something or fall for it all. Ontario, hear the call of the Oshow. It's a podcast, the Oshow. Laura Babcock's the Oshow. Stay informed with the Oshow, Oshow.
Your merch bid.